Today, we are going to talk about group therapy and how Irwin Yalom, who worked a lot on group therapy and is a pioneer in helping us understand what happens in group therapy and what are the curative factors. We're going to take a look at it. It will help you in um, clinical journey and clinical implementation, and also in the exam, they may ask you about like some of the questions related to these concepts. So going to this, it's a group therapy is a very powerful modality of psychotherapy where you harness the dynamic of group to promote individual growth and healing. And uh, Dr. Yalom identified specific therapeutic factors that make group therapy very effective. And there are like factors which are characterized into core therapeutic elements and support mechanisms and the development process. So you want to understand what happens in group therapy under these mechanisms. So if you take it interpersonal growth, um, group therapy fosters interpersonal growth where participants learn social skills by interacting with others in a supportive environment. There is a real-time feedback process which allows individuals to gain insight into how they are perceived and and also refine their own communication styles. And they also practice relationship building. For example, imagine a group member who is struggling with assertiveness, and through practice within the group, they gradually build confidence and apply this skill to their personal relationships. So, and next we think about emotional processing. Emotional processing groups provide a safer place for members to process their emotions. And like, also they develop insight into their behaviors and patterns as peers offer new perspectives of how they're doing this. So there is like a processing experience. So, for example, somebody is grieving with a loss, they may find sharing their experience in the group brings them relief and a sense of connection. So that's mainly the interpersonal relationship growth and emotional processing. Now let's go to the universal experience part. Group therapy reveals that many struggles are universally shared. Like it's members recognize that human experience is a shared experience. Many people who are going through anxiety or something, they have similar feelings and they get validation of their experience, and this brings them comfort. So that's mainly in the universal experience. Now, you also think about hope installation. What happens? Witnessing the progress of others in the group instill hope in members. Members find optimism in others' progress, realizing change is possible. Group cultivation, like positive expectations of recovery and growth, is all occurring by seeing each other. Let's say that somebody is skeptical about therapy, they might feel inspired by seeing someone else overcome a similar hurdle. So that's hope installation. Now let's talk about development process. In the initial phase, the journey of change, you're laying mainly groundwork. Therapy process will begin with establishing safety and building trust. Members feel that safe that they can share their vulnerabilities as a group, sets a foundation process for openness and honesty. This phase is very crucial because it's creating a se- secure environment for a deeper work can occur. Okay, that's initial phase. Okay, so where safety is established, there is trust building, and then you're building a foundation. Now, in the active engagement phase, there is working phase, there is active engagement, and there is a focus on skill development, pattern recognition, and Like, for example, a member may identify a pattern of avoiding conflict and begin working on a healthier confrontation skills. Now, there is integration phase, where this is the final phase where you're consolidating your gains, insight has gained during the therapy, and now you're maintaining the progress outside of a group setting. So, this might involve a member setting goals to continue practicing their communication skills in their workplace. So this is how like group therapy works. Excuse me. So the key principles of facilitators of a group are create and maintain a safe therapeutic environment, foster balance among group members, monitor and support the individual progress within a group setting and context, facilitate meaningful interactions, and maintain professional boundaries. That's like one of the facilitators' functions. So you want to think about like if you're a facilitator, what are your functions? Now, what are the outcomes? Like you come out with more self-awareness and personal growth. You have improved interpersonal relationships and communication, and you have developed more better coping strategies, and you have increased resilience and stability. So now I want you to review this video a couple of times and also look at like this slide, and hopefully this is helpful. Take care. Thank you.